Hi, my name is Dr. Landon Pryor, and I'm a board-certified plastic surgeon. And on this channel, we discuss luxury self-care practices of all forms. Welcome to today's conversation about how to remove acne scars. I understand that acne scars play a huge role in self-confidence. However, I'm going to share with you a few treatment options and clarify best use that make it possible to feel like the best version of yourself again. Be sure to subscribe below and leave a comment with any questions you have. So acne scars are caused typically by inflammation. Inflammation at the site of what generates the acne to begin with causes, over time, thinning of the underlying skin, and that causes the atrophic or depressed acne scars with these chronic cycles of inflammation. What also tends to happen is the scarring from the actual inflammation leaves the pitted scars where the actual dermis is tethered down to the underlying subcutaneous tissue and subcutaneous fat. So it's really an inflammatory process that starts the cycle of acne scarring, and then obviously the longer that inflammatory process is ongoing, the worse the scarring potentially can be. And that's, for the actual atrophic pitted acne scars, there's also secondary effects of inflammatory acne such as dyschromia or hyperpigmentation, which is related also to skin changes from the inflammation. How to prevent acne scars ultimately resides in the ability to prevent acne from happening. Many patients, especially adolescents, because of hormonal changes during puberty, suffer from acne. The best way to minimize acne scarring is to be able to prevent the underlying problem, which is the acne. There's a number of different causes for acne. Some of it hormonal, some of it bacterial, some of it related to genetics and the body's ability to secrete sebum, or that waxy substance that causes the skin to be oily. And all of those work together to potentially create an inflammatory process in the skin that ultimately results in acne. So again, the best way to prevent acne scarring is to prevent acne, and that's something that can be managed with a number of different treatments depending on the underlying cause. There are topical medications that can minimize the inflammation. There's antibiotics that can be used topically as well as orally to reduce the inflammation and the bacterial contamination that ultimately results in active acne, as well as some additional treatments that, depending on the underlying cause, can be employed to minimize risk for acne, such as minimizing hormone surges and other causes in young patients. So in addition to treating the underlying problems, for patients that present with active acne, obviously that needs to be coupled with appropriate skincare. We have a private label skincare line that has an entire spectrum of acne-specific components that can be used to minimize risks of active acne, as well as potentially post-inflammatory hyperpigmentation or darkening of the skin after acne. So the best way to be evaluated for that would be to come in for an analysis. We do an objective analysis of your skin and couple the right skincare regimen to your specific issues and skin types. So for patients that are presenting early in the post-inflammatory cycle following active acne, there's lots of options that can be used to minimize ongoing risks of permanent hyperpigmentation or darkening of the skin. Depending on where you're getting treated, there's a number of different options. We employ techniques including chemical peels as well as IPL and laser resurfacing for helping patients minimize darkening of the skin or hyperpigmentation following inflammatory acne. Also, there's ongoing need to maintain the improvement that they get from the treatments with appropriate daily skincare. So acne scarring is a challenging problem in the aesthetic industry. There's a number of things that can be done to actually minimize the risks and the appearance of scarring after the active acne has resolved. Historically, that has been done with something called dermabrasion. It's like a mechanical abrader of the skin that actually thins out the skin in the area of the scar. And as that skin heals and contracts through the natural wound healing process, the scar visibility is minimized. With now lasers and additionally microneedling that has become popular in the last couple decades in the aesthetic industry, there's what we would consider less invasive techniques than traditional dermabrasion for minimizing the visibility of acne scars. There are certain devices such as Infini, which we have here, which is a combination of microneedling, which conceptually is actually doing the same thing as dermabrasion. It's poking tiny holes in the skin that allows the skin to then contract through the normal mechanisms of wound healing, combined with radiofrequency, which is actually delivering a current of energy beneath the skin, causing thermal injury, and again, through the normal mechanisms of healing, causing skin tightening following treatment. That being said, the decision is made with the patient depending on their expectations for improvement and how severe the acne scarring is. While dermabrasion is a little bit outdated with regards to some of the newer techniques like lasers and microneedling, it still works really well and is a powerful technique for severe acne scarring that would otherwise be refractory to less invasive techniques. So in my opinion, microdermabrasion is a great maintenance treatment for patients that are looking to maintain a healthy glow appearance of their skin and help with the natural turnover that happens with skin cells over time. Generally speaking, that's done in a way that's very superficial, and because of the underlying nature of the acne scarring, with it involving not only the top epidermal layers of the skin, but also the dermis and even some scarring into the subcutaneous fat, microdermabrasion only treats the top layers of skin, or the epidermis, the living layers of the skin. While it may make your skin brighter, that's not really going to be any kind of long-term solution for removing deeper acne scars. So microneedling is a technique that's used similar to dermabrasion that we mentioned, where we're actually causing trauma to the living layers of the skin. And with microneedling, it can be titrated or adjusted depending on what the goals of the treatment are with regards to the area that's treated and the depth of the treatment. Really the more aggressive the treatment, the better the results are going to be. Potentially there'd be a little bit more downtime and discomfort associated with a more aggressive treatment. But it's still a minimally invasive technique that can be used to address, I would say, mild to moderate acne scarring in a way that is going to allow for some improvement over time. So while microneedling is a great treatment for patients that have acne scarring because it can cause skin tightening, it's also a treatment that's commonly used for patients that don't have acne scarring, that are just looking to have a more youthful, rejuvenated look. The same mechanism is in place, which is it causes skin tightening and skin brightening by creating these tiny little micro injuries to the skin, and then as that heals, causes some skin tightening to occur, which ultimately translates to a more rejuvenated appearance. In addition to using microneedling, which can be used to help mild to moderate acne scarring, there is also newer technologies that can be used that employ the same principles of microneedling, but also combine it with different types of energy that can be delivered to the skin. So simultaneously you're creating a mechanical as well as a thermal injury to the skin, and over time that causes combined and synergistic improvement in the skin tightening and ultimately minimizing the visibility of the acne scarring. There's also techniques with volume augmentation. So the only FDA approved filler on the market for acne scarring is Bellafill, and that's actually used to fill in areas of atrophic scars by adding volume in areas where the underlying fat has gone through an atrophic process, which ultimately means that it's lost some of its volume and integrity because of the chronic cycles of inflammation. So with Bellafill, we can actually go in and subsize that scar, release it from its tethering to the deeper layers and then create a pocket to then put in this permanent filler, which will help minimize the visibility of the acne scar. If you enjoyed this video, please leave a like below. We would love to hear your questions about microneedling, microdermabrasion, or dermabrasion in the comments. And subscribe to stay tuned for next week's show. See you next week.